Morning everyone, and thank you for joining us on a Wednesday morning. It is, of course, we're getting towards the end of this month, but we're not quite there yet, and we hope that you're enjoying your week. We know it's midweek, and today we've got a little bit of a weighty topic. It's a fairly general topic and something that a lot of people aren't comfortable talking about, which is why we want to talk about it. And in the studio to talk about this particular topic, we have Dr. Dilini Samarakon, who is a consultant surgeon, and we're very glad that she's in the studio. Good morning, and thank you for joining us.
Good morning.
Morning. So we're talking today about cancer, which is a fairly general, broad-based topic, but obviously for those watching out there, maybe we can start off with a general question. What is a cancer?
Yeah, so now the thing is, now I find that generally people are just afraid of the word cancer without really knowing what it is. Cancer is where one cell which starts as one cell and then starts growing, just as in a normal person's growth of a cell, but it just loses control, where one cell becomes, in the body there is a mechanism where at a particular time it stops growing, and in a cancer it actually stops, that control just goes off, and then the cells grow uncontrollably, and that is one feature. The second feature is that it spreads, and that means it spreads via the bloodstream or via various other things such as lymphatics, and that is why that is a bit scary. The reason is because now it starts in one organ, and then suddenly you find that it has gone to various other organs, and then you can't only treat the primary site, you have to then think about a way of treating the other sites as well. So these are the two main features. First is that the cells start growing uncontrollably. Second thing, that it starts spreading.
Now there are different types of cancers, and a lot of us are, there are a few common types of cancers which everyone knows of. But let's still, nevertheless, go back to what types of cancers there are and which are the most common found, especially in Sri Lanka.
Yeah, any part of the body can actually become cancerous, but now according to the surveys that are conducted in Sri Lanka, breast cancer is the commonest cancer. Even if you take both sexes, it's the commonest cancer. And then anywhere in the body, such as the thyroid, all the endocrine glands which form all the hormones, those can become cancerous. Then the intestines, whether it's the large bowel or the stomach, the gullet, all that can have cancers. Then the kidney and we call it the genitourinary system, that can form cancers. Then the lungs, any part of the body can form cancers, but we have found that breast cancer is the commonest cancer among all those. But in a male, actually the next commonest cancer in Sri Lanka is oral cancer. As you may know, there's a big community who choose beetle, so because of that there is a very high incidence of oral cancer as well.
And before we talk about how to detect cancer, what symptoms, I'm sure there are many symptoms depending on the type of cancer, but before we get into that, what are generally when we talk of especially with breast cancer, what kind of, again, age group does someone start noticing these symptoms at and things like that?
Yeah, now the cancer, now that actually takes us to the cause of cancer. Now there are different cancers have causes plus associated factors. Now the commonest cause that is directly related is a family history. Now if you take breast cancer, it is the best indicator of whether you are going to get a cancer or not, especially if you have a very strong family history. And there are things called cancer family syndromes, where that the next family member has a very high chance of getting a cancer. So that is like a direct cause. There are very famous personalities. Now I talk a lot about breast cancer because because it's the commonest cancer that is in Sri Lanka. Very famous personality. I mean, recently she had a preventive surgery, removed both her breasts because she had 100% chance of getting breast cancer in the future, because they detected that gene in her system, and so she went ahead and did that because she knew that that's that. So that is like a direct cause. So then there are other associated factors such as smoking, now related to many of the cancers, including lung cancer. So if one is actually exposed to such things, then one needs to be a bit more careful. But in terms of like an age, now for breast cancer, by surveys they have detected now 40 to 60 years in Sri Lanka. That is the most likely age that a woman would be more prone to getting a breast cancer. So that age group needs to be scrutinized very carefully. But then again, if you have a family history, then a strong family history, say a younger relation getting a breast cancer or ovarian cancer, then one needs to get into screening earlier than that.
So even at as young as, and I use the term young quite liberally, say as young as 30 or 32,
Yes.
and you know, so is a system in place so that say if a 30 or 32-year-old would want to go in for a mammogram, that would be an all right thing if you given the history or the family history?
Actually, now mammography is for a older female, but in certain instances, as I said, now I see now it's very alarming to actually note that younger people, less than 30-year-olds, sometimes get breast cancer. So in that case, then you know, if you have a family member who has had breast cancer and maybe even died under the age of 30, then in that family you can start doing a mammography early. But generally it's for over 35-year-olds. The reason is a mammogram, one thing, it's a bit uncomfortable to do a mammogram, and one should only do it if it is going to give a positive result which is going to sort of change the management. Now in a younger female, the breasts are a little bit more dense, and the picture that you get on a mammogram, that mammogram is X-ray, and the picture that you get doesn't give as much information as in an older person. So that is why we say it's for people who are over 35. That is the general like a guideline. But you know, younger people, yes, if it is indicated.
Because we're talking so much about breast cancer, let's continue to talk about breast cancer again. What are, we all read in the newspapers if it's breast cancer, you know, if it's breast cancer month, or if it's in magazines for women, that you know that there are ways to basically examine yourself, and that's a starting point. But again, how many people really go about doing these things? So what are the first kind of symptoms that you may experience if you might, you know, if you have breast cancer but you don't know it yet? What are the first kinds of things that might give you an indication this is something you have?
Yeah. Now the thing is, now breast cancer per se, you know, what we want is for the detection of that at a earlier stage than when the patient develops symptoms. Now symptoms per se, breast lump is the commonest, and then you get nipple discharge, then changes in the breast, appearance of the breast, we call it, it's like orange peel, so things like that. That is actually when it's at a very
later stage,
at least later stage, and then the the management becomes, a mastectomy can't be avoided. That is why we say now in the Western world or the developed countries, they detect these cancers at a very, very early stage where there are no symptoms, but because of a thing called screening, which means that you try and get this age group. We said there is a age group at risk. That age group to come into the screening program compulsorily, so that they get screened and they detect the cancers when they are just, we call it screen detected cancers, which means it is detected on a mammogram. So they are like 4 to 6 millimeters or maybe even less than that. So when you detect like that, that is the best time to treat it, because then you can actually protect the breast. Well, I think that is cosmetically very important. Then the other thing is it has probably not spread that much. So in terms of that, then that actually improves the survival. So what we want is to detect the breast cancer at an earlier stage before it causes symptoms.
Let's talk a little bit more about the screening process, because prevention is certainly better than cure, and we'll talk about this in just a bit. Right now, a quick break here on Good Morning Sri Lanka.